I think we'll go back through this again, and this time we'll point out some of the things that affect preload, contractility, and afterload, and that'll help us understand it even a little bit more. One of the things that's going to increase preload is a slow heart rate. And hopefully one of the things you're noticing is there's kind of a counterbalancing effect, that if the heart rate slows down, then the heart will fill up with blood more. It'll stretch out more, so it'll actually contract harder. Kind of similar is exercise. As somebody who's trained in neuroscience, I really, really appreciate when parts of the body save the brain from having to think about things. And it's true that your heart can actually save your brain from having to worry about increasing its output upon exercise. And the way it works is rather clever. The way it works is the way blood gets back up through the veins is when muscles squeeze on the veins. They squeeze the blood back up through the vein, kind of like squeezing toothpaste out of a toothpaste tube. So if you start running across a room, your muscles contract, squeeze the blood up through the veins, more blood reaches the heart sees this increased blood, has more stretch, it increases its preload, and so even before the brain has to get involved, the heart is increasing its stroke volume and increasing its cardiac output. Kind of the opposite of these, and again it's that counterbalancing effect, blood loss, or a rapid heart rate, are going to decrease preload and make it so the heart pumps less blood and decreases cardiac output. Now, rapid heart rate, again, that's kind of a balancing effect. Because if the heart rate is fast, well, we make it not beat as hard, and so that balances out the effect on preload. That balances out the effect on cardiac output. I always consider it kind of graceful that if you have blood loss, it decreases preload, it decreases stroke volume and cardiac output, so it actually decreases the hemorrhaging. Contractility is next. There's several things that go into affecting contractility. I'm just going to hit the main ones. The first one is if you've got more calcium. So calcium is the on switch for the body. So calcium causes muscle contraction. Calcium causes neurons to duct the neurons. If you increase how much calcium is around, this is going to increase contractility because the calcium will enter the heart muscle cell and stimulate muscle contraction. Hormones can do this. The main one that I think about is adrenaline. Adrenaline can increase contractility by stimulating potassium channels. That's kind of the same as the sympathetic nervous system. And also, you can give drugs that increase contractility, make the heart muscle actually beat harder. Now these are really kind of tricky, and I'm going to explain them, but I guess I don't necessarily hold my class to them because we haven't done the urinary system yet. But extracellular potassium will weaken contractility. The reason that is if I can say it really briefly, is that the depolarization phase, doing cardiac muscle action potential here, the depolarization phase is dependent on this potassium wanting to leave the cell. If you've already got a lot of potassium out here, then it slows down this rate. And it actually fatigues the muscle and decreases contractility. It's kind of the same effect, acidosis. Switch colors here so you can see it a little bit better. But acidosis has an effect on potassium because if there's a lot of acid around, acid goes into a cell, and when acid goes into a cell, it kicks the potassium out. So by having acidosis, really what you're doing is causing an increase in extracellular potassium. So it's the same thing, it's just one more complexity in the steps. Another thing, and this one's kind of obvious, is calcium channel blockers. These are given as pharmaceuticals sometimes to decrease contractility of the heart. It relieves things like angina. If your heart is beating so hard that it hurts, well, then tell the heart to not beat so hard and it won't hurt. Now, Afterload, it's not as easy to do in terms of green and red as up and down, so I'm going to switch colors. And what I want to indicate, or what I want to iterate to you is that afterload, again, is what resistance does the heart have to pump against. And I think about it in terms of barbells, dumbbells. If you're lifting a really light barbell, you can lift that really, really fast. And if we think about the heart in terms of a light barbell, what I mean is pumping really thin blood. Then it can pump that blood really, really fast. It has no problem getting all the way through its cardiac cycle. If you pick up a heavy barbell, then you can probably still lift it, but you have to do it slowly. And so what I'm saying is the speed of contraction is dependent on the load. In the heart, if the load is a high afterload, then the heart has to beat slowly. But it has only so much time to complete its cycle. So if it's beating slowly, it might not make it all the way through the cycle. If it doesn't make it all the way through the cycle, we're talking about stroke volume here, which is milliliters per beat. A shortened beat would mean less milliliters. And so afterload directly affects stroke volume, because if you can't pump as fast, you can't pump as much. So what are the things that are going to cause a load on the heart that makes it contract slower? A high hematocrit, I'm going to do pluses just for this increases afterload. A high hematocrit, this would be extra blood cells, hematocrit. If you move to a mountain or you're climbing Everest, you'll make extra red blood cells to carry that oxygen load. That's going to increase your hematocrit, it's going to increase your afterload. Stenosis of vessels. High blood pressure. If you've got constricted blood vessels, and you can relieve that with ACE inhibitors a lot. If you've got a lot of lipids in vessels, I guess that's kind of stenosis. Or lipids in blood. This thickens up the blood and makes it have a higher afterload. Another one is just simply too much fluid. If you drink a liter of water, you're going to be carrying an extra liter of water until you have the chance to urinate that out. It's going to increase afterload because there's more fluid that the heart has to pump against. Alright, so that's stroke volume, preload, contractility, and afterload. It gets a little bit easier on this side because there's really one thing that's affecting heart rates, and that is the autonomic nervous system. If you've had this system already, you realize that there's two parts. So it's called the sympathetic and this is often called fight or flight. And there's what's called the parasympathetic. And this is often called rest and digest. Parasympathetic slows down heart rate, mainly through the vagus nerve. Sympathetic increases heart rate. It's pretty simple. That's about all there is to that. I do want to point out one other thing, and that is coming off of this. So there's another reflex it's called the Bainbridge Reflex. And it's another one of those reflexes that saves the brain. And the Bainbridge Reflex is a reflex that increases heart rate when heart muscle is overstretched. What that's going to do is if the heart is sensing too much blood, not only is it going to increase its preload, but it also has a way to increase heart rate. So if the heart is stretched too much, it'll increase preload. Through the Bainbridge reflex, it can also increase heart rate.